Yeah, thanks for the question and thanks for having us. The reason we conducted the study is because there's been increasing use of mechanical circulatory support devices in recent years, including Impella. But there have been limited randomized clinical trial evidence, actually, of patients who are treated with Impella, particularly compared to intra-aortic balloon pumps, particularly in the setting of acute myocardial infarction with cardiogenic shock. In fact, only a total of 74 patients have been enrolled in randomized clinical trials, and so understanding that there was a relatively limited evidence base for the use of Impella in acute myocardial infarction with cardiogenic shock compared to intra-aortic balloon pumps, we felt that it was important to conduct a study like this.
Yeah, so the population of patients was those with acute myocardial infarction with cardiogenic shock undergoing PCI. The patients were identified through the American College of Cardiology's National Cardiovascular Data Registry, a large national registry of patients both with acute MI and those undergoing stenting. We actually brought those two registries together and did a propensity-matched analysis comparing those patients receiving an Impella versus those that received an intra-aortic balloon pump. Our primary endpoint was in-hospital mortality, and our primary safety endpoint was in-hospital major bleeding.
So we presented utilization findings, and we found an approximately 2.5-fold increase in the utilization of Impella among all patients with acute MI and cardiogenic shock between the fourth quarter of 2015 and the fourth quarter of 2017. And then we examined closely the in-hospital outcomes that Dr. Desai mentioned. We found an approximately 10.9% absolute increase in-hospital death among patients who were treated with Impella compared to those patients who were treated with intra-aortic balloon pumps, which was statistically significant. And we found an approximately 15% absolute increase in the risk of major bleeding among patients who were treated with Impella, again, compared to patients who were treated with intra-aortic balloon pumps, also a result that was statistically significant.
So I think there's two primary explanations for these findings. One is the significant increase in bleeding complications with the Impella device relative to the intra-aortic balloon pump. We've known, and there's accumulating body of evidence to show that in-hospital bleeding complications are associated with adverse cardiovascular events, including mortality. The mechanism for that is probably multifactorial, whether it's withdrawal of antithrombotic therapies, blood transfusions, others. That has been a finding that has been sort of repeated and shown in various settings. And so I think that's an important driver of the findings in our study. I think the second piece of that is that the way a device performs in the real world, in unselected settings, likely differs from how it performs in the setting of carefully selected sites for a randomized trial. And so I think that between those two factors, we think that that's likely the explanation for these findings.
Yeah, that's a good question. We think that our study really leads to a call for better evidence and guidance on the use of mechanical circulatory support devices and overall in the care of patients with acute myocardial infarction and cardiogenic shock. These are very sick patients of a very high risk of mortality, and we have a lot of therapies that could potentially benefit them. And we need to figure out in what scenarios of cardiogenic shock do different therapies work, and what are the best ways to get those therapies, what's the best timing of those therapies. So there's a need for a lot of additional research and evidence generation that can help to guide clinical practice.
Yeah, I think it would be great to have a well-done, large, well-powered clinical trial comparing amongst the different strategies available to providers for the management of patients with acute MI and cardiogenic shock. The Impella is obviously one important device in that setting. The balloon pump, there are other strategies as well. And I think we need better guidance and better evidence more broadly in terms of the optimal management of patients with shock. And I think the mechanical circulatory support devices is one important area, but I think even more broadly, we need better evidence to guide the management of patients with MI and cardiogenic shock.